Dr. Brittany Huynh is a combined pediatric rheumatology adolescent medicine physician who completed her fellowship training this year at Riley Hospital for Children in Indianapolis, Indiana. She is an active member of the Childhood Arthritis and Rheumatology Research Alliance, or CARA, and serves on the leadership team of the Reproductive Health Work Group. Her research and clinical interests include addressing the reproductive health needs of young people with rheumatic disease and developing independence and clinical decision-making in young people with rheumatic disease. She will be starting a position at the University of Alabama at Birmingham in the departments of pediatric rheumatology and adolescent medicine this summer. Please welcome Dr. Huynh.
All right, thank you so much for that introduction. So I've been invited to come and talk about puberty today and how that might interact with juvenile arthritis. So for our agenda for today, we'll touch a little bit on how JA can influence puberty. We'll also talk about the emotional impacts of puberty, what that development looks like for young people. I heard that was the major interest this year. And then at the end, we'll touch a little bit on reproductive health considerations. So as you can see, this sort of spans the lifespan of adolescence and the different topics that we'll work up to. So first, starting with puberty and juvenile arthritis. So many parents have asked the question, is puberty impacted by JIA? And are there things that I need to be looking out for my child? So there is some evidence that kids with JIA may experience delays in puberty, but the data really isn't conclusive. There are some things that might increase your risk for delays in puberty in particular. This includes corticosteroid use. So if your young person is on prednisone, for example, especially at higher doses and for longer periods of time. Type of disease, especially inflammatory diseases and high levels of inflammation, also can lead to delayed puberty. Within the realm of juvenile arthritis, this most often happens for people with systemic onset JIA. Age of disease onset. So as you might imagine, if it comes on right before someone might enter puberty or during that whole phase of puberty and development, it might delay how that progresses. Disease duration as well, especially as we think about longer-term inflammatory processes, can also cause a higher risk of delays. And generally, JA and the inflammation that can come with it can be related to endocrine disturbances, so hormone imbalances, that then in turn can lead to changes in puberty. The good news is most kids with JIA transition into puberty without any issues. So this isn't likely to affect our young people, but it can, and so it's important for us to be aware of. The other important thing to know is that this delay in puberty for our young people with JA doesn't typically cause changes in their overall growth. But I do want to talk about what are the things that as parents and caregivers you should be looking out for. In order to know that, I want to talk a little bit about what is early puberty and what is delayed puberty. So first, thinking about early puberty. For people who are assigned female at birth, developing breast buds before the age of 8 is too early. Now, breast buds is a very medical term. Who here might know what that means? Like 1 or 2 people, cool. Thanks. So what that means, and it can be really tricky, especially for people with larger bodies because fatty tissue can develop there too, but it's a little bit of tissue that first develops under the nipple, and it feels different than the rest of tissue or like fattier tissue in that it feels a little bit rubbery. And so if you ever notice that in your younger child, that is something that you need to bring up. For people assigned male at birth, having genital growth before age 9 means that things are starting too early. And then as far as pubic hair development, if it starts before age 8 and someone assigned female at birth, or before age 9 for someone assigned male at birth, that also is a sign that something might be wrong and needs to be assessed. Then thinking about delays in puberty, which frankly, for our population in rheumatology, happens a lot more often. The first one is not having any breast beds by the age of 13. This is an important marker because about 2 years after breasts start developing is when you start your period, and then the clock really starts as far as how much time your child is going to have to grow. And so this is a really important thing to be aware of, and if your young person comes to you with concerns, bring it up with their doctor. Having no period by the age of 15 or 16, frankly, the guidelines depend a little bit on what specialty you're in, but that is another sign that things are delayed and need assessed. And then for people assigned male at birth, if they don't have any genital growth by the age of 14, that's also a sign that something might be wrong. Oops. Oh, there we go. Okay. So why do we worry about differences in onset of puberty? So first, the most common reason that delays in puberty occur is something called constitutional delay in puberty. It's basically a fancy medical term for saying, we don't know, but there's nothing really wrong. And this sometimes can just run in families. So if you as parents had puberty start later, your children are more likely to have that happen as well. However, and I should say, if that is the case, it just progresses on its own. You don't end up needing an intervention, and you just sort of watch and wait. But it also could be a sign that there's something else going on. And so other conditions that can sometimes delay puberty could include endocrine problems or hormone imbalances. It could include genetic conditions, so things like Turner syndrome or Klinefelter syndrome, if you've heard of those, which can have longer-term impacts on things like fertility. It can also very, very rarely be caused either early puberty or delayed puberty by tumors. And so this is really important for us to work up and to catch early on. Second, early puberty can affect final adult height. And so when I mentioned, catching breast buds, the importance is at some points in puberty, your child's growth plates will fuse. And so they don't get much more growth at a certain point, even if you try to intervene. And so it's really important to intervene early. And what that ends up looking like is an endocrinologist prescribes a medicine to help put a pause on puberty until they've had appropriate growth and then can continue. The other thing is that if puberty is delayed too long, it can also affect your bone development long term. So our bone density, or how strong bones are, is really predicted by how much they're allowed to harden during adolescence and early adulthood. We lay down the bones that we are going to have pretty much for the rest of our life, and somewhere around 30, it's sort of downhill from there. And so we want to make sure that our young people are able to do that throughout this time period. Otherwise, when they do get to older ages, they'll be at a higher risk of things like bone fractures and things of that nature. Another question that comes up is whether puberty causes disease flares. The answer is we don't really know. Now, where does that come from? Thinking about estrogen, there have been a lot of doctors and families who are worried about that because it has been shown to play a role in the inflammatory process. And when we think about not typically juvenile arthritis, but other inflammatory diseases like lupus, it happens more often for people who are assigned female at birth and after puberty when their estrogen levels are much higher. In reality, studies don't really give us good information to say, yes, estrogen is not as good for disease or flares disease, and so that's still really open for interpretation. While research is limited, some women with JA report flares of disease during menstruation. This might be associated with fluctuations in hormone levels, although we don't truly know. And other pieces of that could be, periods, when you have period cramps, that largely is also driven by inflammation, which is the underlying process in our disease. And so that could potentially amplify things. And the last thing is, whenever you're in pain in one part of your body, everything just hurts worse. And so that could be another reason why people feel worse and have flare-ups around the time of their periods. Again, these are hypothetical associations. They're not well tested, but things that we have thought could contribute or might explain that association for some people. So we've talked a little bit about puberty. An important part of this for a lot of people is periods, because they play such a large role in how we experience our lives and how active we can be in our lives. I want to talk a little bit about what is normal versus abnormal for periods, because in my adolescent clinic, I see a lot of people come in who have suffered a long time with things that were not normal, but didn't know that there was anything you could do about it. So, what is normal? It is normal to have a regularly scheduled period every month. Now, I say every month, but cycles can sort of vary from person to person. And so on average, it's 21 to 35 days from the start of one period, that first day, to the first day of the next. Now, this can vary a little bit in the first 2 to 3 years after someone has a period. During that time, your body is still trying to figure out what this thing is, what it's going to do, and so it might be irregular, and it might have changes in how much you bleed. That's all normal, but if it is still too distressing, it's too much, or you're just worried about it, it is always okay to talk to your doctor about it. It's also normal for it to last up to a week. Much longer than that can put you at risk of things like anemia. So I also want to talk about what is abnormal. So having severe pain where you're missing out on being able to participate in school or do the things that you need to do, want to do, that's not normal. And that's something that you need to get help with so that you can participate in your life. It's also not normal to miss or have irregular periods, especially if you're out of that initial 2 to 3 year window. And so this is another thing that you might need to get assessed because it could be a sign of something else going on, such as PCOS. Having dizziness, especially dizziness that doesn't just occur with periods, but occurs all the time, or being really, really tired. I will say, most people are a little tired when they're on their period, but if it becomes too much, then that could be another sign. These things can tell you that your child might have anemia. This can happen because they're bleeding too heavy, they're bleeding too long, or they're bleeding the regular amount, but it's combined with medicines that also have the side effect of lower blood cell counts, like methotrexate, which who with arthritis hasn't been on methotrexate at some point? Many people also experience heavy bleeding and longer than usual periods. And so if your young person is having excessive bleeding, which medically we talk about if you're filling a pad or tampon an hour for 2 or 3 hours in a row, you need to be seen. And if your periods last longer than 7 days, that's another reason to just check in with your doctor and make sure that things still look and feel normal. The word feel probably was not the best thing to say. No one's going to feel physically anything, but that medically it seems like things are okay. I also wanted to provide you with some tips because frankly, no one teaches us how to manage this for ourselves. And you may go to your rheumatologist and they don't know that they have tools that can help you too. So the biggest thing that I find is NSAIDs can be the most helpful thing for period pain. This means ibuprofen, naproxen, meloxicam, things you probably have as an as-needed medicine for your arthritis. And the way this should be used is scheduled. So what I normally see is young people come in, they have terrible cramps, they wait until it's really bad and they can't take it anymore, and then they're like, maybe I'll take a naproxen. This is the wrong approach. Because cramping is sort of like a fire. You don't want to wait until it is blaring. You want to put that water bucket on it as soon as it starts to become a spark. And so what I tell my young people is from the first spot of blood or the first twinge of a cramp, you start taking it, you take it scheduled until you know that your period is generally going to be over. This has two benefits. It really helps with cramping, but the other thing is it decreases the total amount of bleeding that people have too, and so overall can just make it more comfortable. I like to highlight this in this crowd because your rheumatologist doesn't know this is helpful. And this is something that you can, before you can go to someone who can help you more, to tell your rheumatologist, hey, I know you feel comfortable prescribing this medicine. Can you at least help with this to get me started? The other thing that a lot of parents don't know what to do about is if they're worried that their young person can be having a problem with periods, either irregular bleeding, too much bleeding. And often families come to my office and they're not really sure what to tell me, and the young person hasn't really been prepped in what's important to even be looking for. And so I wanted to give you tips as well on what are the things the doctor is going to ask you. So the most important thing you can do is track the periods. The number of times we spend like 5 to 10 minutes arguing over exactly how far apart they are, it can just be managed pretty quickly by just keeping a journal. And it can be on paper or it can be an app, whatever you feel most comfortable with. But that can give us a really good idea of timing. How often are you bleeding? If you don't do that, having an idea of how often does it happen? Are we having a period every 2 weeks or every 5 weeks? Changes how I think about you and what could be going on. Are your periods heavy? And what days are they heavy? Is it just heavy for a day, or is it really heavy for 7 days? Because that would be really concerning. Having a way to quantify that too. And so thinking about the question you'll be asked is, how many pads or tampons do you use in 24 hours on your heaviest days? And keeping some sort of track in your mind of like, okay, it's only 3 versus I use 15 can be really helpful, and knowing what kind of product do you even use. Most teens that come to my clinic don't know, but I'm much more concerned about filling an overnight pad than I might be a teen product. So bring all that to your first appointment, and that can really help to give you a head start. All right, so I'll also transition into emotional challenges. We all know that there's a lot of change going on in adolescence, right? Hormones are changing, bodies are changing, mood swings are really common, and social dynamics just change so drastically. And this can be really hard for everyone to navigate, caregivers and young people. And so I wanted to give you, a framework of what does that developmental process look like for young people, and then what are the normal challenges that just get amplified for people who have a chronic illness like JA. So first, I do want to comment that this is how adolescent medicine professionals think about development throughout adolescence. And I want you to think about it like the stages of development that you were often told to track for your babies and toddlers. First they learn how to babble, and then they say mama, and then they finally learn other words. There are time frames that are highlighted, but everyone's really different. And so we tend to see people progress, but the exact time isn't as important. So don't panic if you feel like your child is early or, later on in some of these. So as far as early adolescence, this is the period of time generally between the ages of 10 and 13. So this starts really in later elementary and then continues through middle school. During this time, peer groups are mostly same-sex, and early adolescents just really want to fit in with other people, and so they generally tend to start becoming a lot more self-conscious than you might have noticed earlier in elementary school. They also are more concrete thinkers. So their brains are still developing, still learning how to make those connections, and so they may have a harder time thinking about the long-term implications of decisions that they make right now. A great example of this is from Inside Out 2. Did anyone see this movie? Okay, I'm so glad that people know about this movie. Strongly recommend, as an adolescent medicine professional, it just was masterfully done. For those of you who didn't see this movie, really great example of the later phase of early adolescence. So it follows this young girl, her name's Riley, she's 13, just finishes up 8th grade, and it's during that summer before she enters high school, and she goes away to hockey camp with her best friends that have been friends forever, and they tell her that they're actually not going to be going to the same high school as her, and that she's going to be alone. And she, at the same time, enters puberty and develops these new emotions of anxiety and envy and embarrassment, and doesn't exactly know how to navigate all of those things. And so in trying to learn how to control those, she snubs her friends in the process. Everything in her life you see is being driven by these new emotions that she hasn't quite mastered yet. And so it's hard for her to really consider the consequences of her actions during the majority of the film, with one of the examples being at the top, she dyes her bangs red, the colors of the high school team, thinking, this will show my dedication to the team and we will be best friends, which obviously is not how that works. And so this is just a really great example of that abstract thought when you approach your young people who are in this age group. Middle adolescence tends to happen between the ages of 14 and 16. And so we are now solidly in high school at this point. At this phase, peer groups tend to be more mixed sex. There's more emphasis on romantic relationships. People tend to start dating and experiment with the kinds of people that they want to be around. They experiment within dating relationships, might try out new peer groups, might start experimenting with substances. This also tends to be a time they become more self-conscious about themselves and their bodies. And when you already have other things going on that other people don't, this is a time where that conflict, especially with JA might surface. It also tends to be a time of increased conflict with parents. And so if you're in the middle of this stage, unfortunately, it is very normal for them to think you don't know anything that you're talking about, or be more irritable with you or snap at you. And I promise this doesn't last forever, but is a really important part of them developing who they are in their independence. So that brings us to late adolescence. This tends to start in late high school and then into that college age. That's around 17 to 21 is where we tend to see this. And during that time, people tend to have less focus on peer groups and then become more invested in these individual relationships. They more often become more comfortable in their own skin and develop their own sense of identity and who they are. Fortunately, they reestablish relationships with parents and caregivers in a different way, and they may come to depend on you more during this time as they're figuring out budgets and laundry and health insurance, for example. And this tends to be the time where they start to realize how much they appreciate all the things that you've done for them over the years, where they may not have expressed it in the same way before. Young people at this phase tend to be pretty idealistic. They see what they want in the world in a way that I think we sort of lose as we get older than that. And they also have developed these skills to think really abstractly, and so have a better sense of what long-term consequences, I hate to use that word, but like the benefits they might see at the end of things or how things might go wrong. This is my favorite stage. It's super fun to work with. So we've talked about our normal stages of development, and I think you can kind of see how some of the conflicts can arise with things like body image and seeking independence. And so I want to also touch on these topics that are completely normal. in that they are typical for people, but also can be amplified in the setting of having a chronic disease. So first, we've talked about in many phases, especially early and middle adolescence, the need to fit in with their peer groups. It doesn't feel good to stick out at this age, which makes it really hard to have a disease that they have to work really hard at and protect themselves in a lot of ways they don't see that their peers are doing. This is also a time they might start to skip or hide or avoid medicine because they really want to feel normal. This is a point of contention in a lot of my office visits between parents and their young people. You know, how often are they missing or not missing? And I think it is a lot harder to understand as caregivers who have worked so hard to get them to this point and some of those feelings. But I also wanted to share with you, just to give you maybe a different perspective and greater appreciation, some experiences that I learned recently. So over the past year, I've been doing a research study talking to young people about their experiences with having rheumatic disease. And so many of them just shared that, particularly having to have this medication that they take regularly, for some daily, it just felt like they had no control over their lives. That was their life, taking this medicine. And they didn't have any independence away from that. One person in particular was really articulate talking about this, and the word she used to describe it was dehumanizing. She talked about, every morning waking up, having to take the pills, the taste of those pills in her mouth, the feeling of it going down her throat, and just every step, and knowing that for her this was forever. And so I think finding ways to show up for your kid and understanding what this feels like can be really helpful in helping to problem solve together how to get through and still take care of yourself, but that this is hard. Body image is another big topic for adolescents, especially as they try to fit in and see who they are in the world. There's more difficulty for everyone with body image, but especially if you have a visual disability, it can be more challenging because it does stick out. If you feel like your body has turned against you, which I hear over and over again in my office, that doesn't make you feel good about your body and what it does. Also, a lot of people have weight gain or weight losses that happen around their medications, so either caused by medications or from treating their underlying disease. And having shifts can also impact how they see themselves and impact their body image. Lack of control in all of these different pieces of their lives often causes people to try to find things that they can control too. And in the setting where they've had these fluctuations in weight, we also see more young people struggling with disordered eating or eating disorders, which is more common in people with chronic illness than in the general population. And we'll touch on that a little bit in a moment. Dating becomes a big topic. And is, a source of struggle for everyone as they go through adolescence. But it can be more complicated for young people with a chronic illness like JA. And so they may feel uncomfortable sharing that they have JA with a dating partner, for example. And this can lead them to avoid, skip, or just not take their medicine as well, either in an effort to feel normal or as a way to try to hide it from other people in their lives. Self-esteem is a really big topic as well and can be impacted either by over-identifying with their disease or, not feeling like they connect. Bullying is a really big issue as well, really for all teens, but if you are different in a way that other people know about or see, it can escalate that at times, as can those weight fluctuations. I see that a lot, unfortunately, in my young people who have been on steroids. The other thing is this desire for independence. I think you could sort of feel that trajectory as we talked about how young people develop through adolescence and what those developmental phases are. And they're trying to figure out, who am I? How do I navigate this and separate myself from my family? And it's really hard to not feel independent in the setting of your disease as well. And so I think the other thing that's really hard for caregivers is you've invested so much and poured so much into your young person and their medical care, fighting for them to get the medicine that they need, for them to feel good, for them not to be in pain. And at some point, you work so hard that some kids might feel smothered by how deeply you care about all of those things, and really want them to as well. This sometimes also means rebelling and skipping medicines or not wanting to go to appointments. And that is, unfortunately, also sort of normal. We have to make sure that they're safe, but it's part of the process of learning what life is like with the disease. I know we talked about a whole range of issues, and I honestly wasn't sure what all the different things that you all were interested in were, because it's such a broad topic. But I also, because of that, wanted to open up for some discussion. Has anyone had any of these things come up, or different things, and how did you handle it, or how do you talk to other parents about navigating that when they're in an earlier phase of that process than you are? I think someone has microphones, if you raise your hand.
So for our teen, I think it's really weird to hear my voice on this. It's hard to focus and speak. Yeah, so our teen this year has started, she's been in 9th grade, she just finished, and had been an excellent student up until 9th grade. And then when she got into the high school, like a convergence of her diagnosis and ADHD and like emotional development, it just, everything came crashing, and it was super hard, and she like did badly in some classes, and now she's trying to play catch up, and it's been a real struggle for us to figure out how to navigate that and how to help her. So it's just, I have no answers, I just have a lot of complaints. It's been hard.
Yeah. And it feels really unfair for this to happen at that particular time in someone's life, because there's already so much going on, right? And we'll talk a little bit about mood as well and how we can support people through that. But I do feel for you because you're not alone. And I know a lot of school liaisons have been helpful for some of my patients, but it just is a really hard situation.
Thank you so much. Do you have any recommendations in terms of behavioral or social skills that might be helpful for someone who'd be struggling with fitting in or self-esteem issues? I see bullying there, and I think about responding to that. That's a behavioral or social skill. So you have any thoughts on, just for us to think about behaviorally and socially, like the actual skills? Should they be introducing themselves more? Or how do you start a conversation? Or things of that nature. That's kind of where my thoughts are when I think about how do I talk to my little girl about going into middle school. And I know the JA overrides all of what she withdraws from or how she feels. We use that spoons analogy, or we're trying to, how many spoons do you got today, I guess. So anyway, any thoughts on that would be very helpful. Thank you.
Yeah. I mean, it's so hard with the bullying, and I think transitioning to middle school can be a really helpful transition sometimes too, because she hasn't gotten there yet, right? Because the pool of potential friends is so much larger. And so I'm glad that she's going to have that opportunity. I talk to teens about, how do you What are the things you're interested in? How do you find and connect with those people? How do you get yourself in those spaces? Because the more that you can explore, you're not going to be friends with everybody. You're not going to get along with everyone or find your best friends with the first person you meet, but the more people you try to expose yourself to until you find that group that you really click with. But I know, it's so hard, and it's so hard to watch. I don't know that that was actually helpful, but it's such a situation-by-situation circumstance. Has anyone else been in that situation or found ways that they've found helpful?
Do you have?
Hi. I just wanted to touch base on his
Yeah.
upcoming issue. So my son is 13, so he's going into 8th grade. And, you know, he's been through a couple schools for various reasons, whatever. But the bullying is a real thing, for sure. And honestly, like, if your child's school has, like, mental health
Yeah.
people, like actual counselors, like from a legit, and I'm not saying that guidance counselors aren't helpful. I'm talking about your actual, like, psychiatrist, therapist, stuff like that. World of difference.
Mm-hmm.
Because that's one person, one grown-up that they can rely on every week to show up and talk about their feelings privately. Telling you, therapy. Everybody needs therapy anyway, but whatever. That's another issue. So, thank you.
No, it's so right. The right guidance counselor can make a world of difference in creating that safe space for when things do come up at school. So thank you for bringing that up.
I think I can also share. So my daughter's 14, almost 15, and going to be a freshman. So middle school, I thought, like, March, if you would have talked to me, I would have been like, we made it through middle school. And then it, like, we took a deep dive. But I think, along with what she's saying, the levels of support, like, because I'm a single mom, but Adeline knows people everywhere that she can talk to that's not me. I mean, we have Corinne, she has people at church, there's people at my work that she can go to. So if she can't talk to me, I try and have an open line of communication, but sometimes mom's not enough, or we don't want to tell mom. But there's other people that she knows she can go and talk to. And I think that's really important, and that's what's really helped us. So I think that's a good strategy too.
On with that too, what helped me, my son started 6th grade, and it was having someone for me to contact at school, because it went from an elementary school we'd been at, I worked at, to all of a sudden 7 teachers. Who do I go? And so that helped me. I connected with the band teacher and a couple others, and let him join whatever he wanted, even if it was hard. And he missed school some days because of that, but it helped a lot for me because he had people to talk to, but supporting him if I didn't know and felt like I was just dropping him off to strangers was hard. So that helped us too.
My name's Emily. I've had JA since I was 2 and I'm 17. And one of the biggest things, and this is, like, probably not the nicest to say, but it gets to a point where, like, you kind of just have to get over and, like, not care, which is, like, not very helpful to say, but I've had bullies in the past, and it's the thing that they just don't understand. And you're just going to have to think, they just aren't going to understand at all, and I don't need to explain it to them because they really don't care. Like, they're just going to, like, some people are just mean. They don't care, and you just have to get over, like, they have stuff going on, and they just want to be mean, so it's not my issue to, like, let them know and, like, explain how I'm feeling because they really don't care. And I feel like a lot of middle school is just, like, everyone's just in a mood all the time, so no one really cares. So I think just, like, not ignoring the feeling of being different, but I mean, a lot of my friends knew growing up that I had JA, and I was very open about it. Like, I've never not talked about it because I'm like, it's just what I have, and you just have to deal with it sometimes. So I think if she, like, your daughter is very open to being like, I have it, and that's just something you're gonna have to know about me. And I know sometimes people don't want to point it out because they don't want to feel different, but having people understand that I have something and it's not going to go away, but I just need people to understand that I have it so we can like move on. Because I know some of my friends, they're like, some of them really don't understand, and that's okay. But even them knowing that I have something is always just lets me breathe around them. And I can have a person that they just understand, like, oh, I'm just not feeling good sometimes, and that's okay. And those are the people that, as you get older, you'll find more friends that are more open to just understanding, and they don't have to know the whole gist of it, because a lot of my friends really don't understand, but them just understanding that you don't feel good and it's okay. Like you can breathe around me, like you could take a day just to like, lay down. Like I have some friends that they just come over to my house and just like, we just like sit on our phones together. Like you need to find the people that you're comfortable with, that they're comfortable knowing that you're uncomfortable. And I think that's very big, because some people get very awkward when you tell them that you have something wrong and they don't know how to deal with it. And that's when you start feeling uncomfortable being open about it. And I think at the end of the day, you just have to be like, people don't get it, and that's fine. And you have to find the people that do get it.
Thank you for sharing that.
I kind of want to piggyback on what Tara said. I worked at my kid's elementary school, and when she went to middle school, I was terrified from people I worked with and knew her going to 7 strangers that have never met her before. So whoever is in charge of 504s at your school, request a transition meeting before school starts, and they will sit down, and it's not a 504 meeting. It is literally you talking, having an open discussion about this is what to look for, this is what, and let your child speak, and that way it's not a day that things are bad, that they have to say, hey, this is what's wrong. And it was great because I talked, and every year I write up a letter and give it to all my kids' teachers, and they get you can request the pamphlets from the Arthritis Foundation, teaching a kid with JA, give those to every single teacher. But it really helped. They listened to me, and then they literally physically all turned to my daughter and said, we want to hear from you. What do you want us to know? And so she was able to use her voice that way. So it wasn't in front of peers. It was before school started, so they all knew what to expect, what to look for. And then the bullying, my daughter, she has endocrinology stuff going on. She's short stature. She's 12 and a half and barely 4 feet tall. She's on daily growth hormone injections. And the first day of school, a kid in PE said, hey, stand up. And she did. And he said, no, I said stand up. Joke. And she came home and what do I do? And I was like, that's about that kid. I was like, make it. And so the next day he said something, oh, are you sure you're supposed to be in middle school? And she goes, are you trying to tell me I'm short? And the guy goes, well, yeah. And she's like, well, thank you for telling me. Like I wasn't aware, just trying to turn it to make them feel like the dumb person. But yeah, that transition meeting was a world of difference for us. Getting to know the team that's going to be with your kid is a huge deal. It's great for you to have that conversation and your kid to have that. It was really good.
Thank you so much, everyone here, for sharing your experiences. There's so much wisdom in this room because you all have been in the trenches of this. My daughter is 3, so I get like these little windows. But what I will say is, at the end of the day, this is a hard period of time, and your daughter's going to make it through because she has support from you. And having parents who care so much and are trying to work through this with her, that she knows she can come back to at the end of the day, is huge. So, for what it's worth. All right. So, we've talked about some of the struggles that come up, and I also want to talk about some of the things we can do to help support our young people as they transition and develop into young adults. One of the things is start to give them pieces of independence. This will need to be tailored based on their age and maturity and all of those things, but helping them to learn little by little how to start taking care of themselves from a young age will really help them as they transition and later enter into the adult medical world and just adulthood in general. The advice I've gotten from a lot of young people and not so young adults with JA is that it's okay to let your child fail. they, if they're responsible for their medicines, for example, and they miss a few, or, they really overexert themselves because they just really want to go, and they're going to be in pain, sometimes we let them, because that is a really good learning opportunity for them and helps them to learn what are my boundaries. And at some point, one of the people I talked to last week was like, I know I'm in pain when this happens, and I know I'm not going to miss my medicine because I'm going to be really miserable for it. I say that. It is easier said than done, of course. And it's still important for us to be monitoring because you are your child's emergency brake system too. So if you start to see them get into a danger zone, we're having flares of severe arthritis, that can cause joint damage long term, we're going to have to step in. How else can you help set your child up for success? So the biggest thing, building a relationship built on open and honest communication. The biggest goal of parenthood is that your child, when they are struggling, when they need help, they feel comfortable and confident that they can come to you. I'm also going to give a plug because there's a session on this later, so I'm not going to go into too much more detail, but please join us for that. Also, find ways to give them some responsibility over their care. If they're not ready to take over medication management or how can you help figure out how to still keep them involved and give them choices where it's possible? So this can be helping them figure out when do you want to take their medication. I've had some families who have big fights over you have to take it at this time, so we've got to wake up super early, and that way it's arranged so that later in the day you can take this other medicine. Sometimes the medicine intervals are not as strict as we think, and so if it's a struggle and it would help your child to be able to do it at a different time, bring your doctor into the conversation. It can help for them to decide where is the best place to have their medicine so that they remember, or how is it taken, and even giving them decisions around, do they want their methotrexate as an injection or a pill? If they're taking a pill and you're crushing it, what do they want it to be in? As much choice as possible, it's going to be really helpful for them. And I think the biggest piece of this is you're helping to set them up for having the ability to advocate for themselves later in the medical system, because it really starts young with helping them learn that they know about themselves and they can have some control over situations too. And then thinking about how else can we support them in transitioning to independence in their health care. So one, encourage them to come to their appointments with their doctors with questions and make them ask the questions. They will likely, like all adults almost too, come into the office and immediately have a blank, I don't remember any of my questions, so have them write it down. And the most effective way I have found is in their phone, because that almost always makes it to the appointment with you. Also ensure your young person is speaking to your doctor. At some point, if we have taken care of you all for a really long time, we forget. At some point, your child is at the age they can participate, and we just keep talking to you. And so it's okay and encouraged to bring your child into the conversation. That could look like saying, what do you think of these medicine options? It's really important for me that you have a choice in where we proceed from here. Or, wow, that was a lot of information. What questions did that bring up for you? That way they know their opinion is valued. It signals to us, oh yes, you're old enough for this now too. And so can also help encourage us to talk directly to your young person. And then, doing all of these things can really help give your child the opportunity to start making decisions, but with your support and with you as guidance. So this can help your young person to take charge of their health and help to prepare them for that transition into adulthood later on. I'm also going to touch on some topics that are that come up in adolescence and sometimes can be even harder for young people with chronic illnesses. So one of the big things we all worry about for our young people are mood disorders, and this comes up a lot for all adolescents. Studies show that it affects 10 to 20% of adolescents overall, but these numbers rise to up to 60%, depending on the studies, for young people with rheumatic diseases. And so this is something that we need to be keeping tabs on and make sure that we're supporting our children through. So what do you look out for? This becomes challenging because mood swings are pretty normal during this time, but there are some signs that might be more of an indication of a mood disorder. So one of those things is social withdrawal. If they have several friends that they usually hang out with, they usually hang out with the family all the time, and all of a sudden all of that stops. That is not typical. If they have changes in eating, this can be overeating or not eating as much. Changes in sleeping, either sleeping all of the time, which admittedly, adolescents need a lot of sleep, but out of the ordinary for other people their age, or they have a really hard time falling asleep. Activity levels, this is sort of an odd one, but if you notice that they're just really slow in their movement, slow processing and answering questions and things of that nature, but it's not related to their disease or pain, that can be another sign to keep an eye on. Sudden decline in academics sometimes can also indicate mood disorders. Things like depression and anxiety can make it really hard to concentrate and to learn. Loss of interest in multiple activities that previously they really enjoyed. They love video games, now they won't touch them. It's a little suspicious. And increased anger and irritability. I included it even though I recognize that this is a normal part of adolescence as well, but because depression doesn't always look like sadness. For a lot of the teens that I see, it looks like anger and irritability. And so if you see that in the setting of some of these other things, it could be a sign that you need to talk to your doctor. So there are a lot of people who can help you under these circumstances that I just want to make sure that you know about. So you can go to your pediatrician or an adolescent medicine doctor. These are people who usually have referral lists of therapy resources available in your community, and they might even have the people that they really know and know they do a good job with people your young person's age. They might also help with medication if that's needed or desired. Counseling is incredibly important. I agree with the person who said probably everyone needs therapy. And you know, this can be a really challenging thing, I think, to navigate finding a therapist because it is so dictated by your insurance. But I'll give you a tip on the next slide of how you can go about that. And you should also know that there's lots of different therapies that are available. It can be individual, one-on-one with your young person. It can also be group therapy, so more like support groups. It can be family therapy. If there are other things going on in your family's life that's impacting everyone, sometimes it's helpful to tackle it as a group or to get tips on how you can help your child and help parent your child through it too. A pediatric psychiatrist is another physician who specializes in medication management and more complex psychiatric diagnoses as well. But particularly for our young people who have many different chronic illnesses and lots of meds, they can be really helpful in figuring out what is going to work best with all of the other medicines on board. A pediatric health psychologist, these are my favorite people, but they're hard to find sometimes. You can look for them in your at your children's hospital or within the medical system. But what I really appreciate about these individuals, they are psychologists, but usually focus on young people with chronic illness. So they might understand how your young person is feeling or the things that they encounter in a different way than someone in the community. And then pain management specialists can also be really helpful We know there's a mind-body connection with pain, and pain comes sort of with the territory of JA for a lot of people as well. And so finding someone who can help you navigate both pieces to improve both sides of that can be really helpful. I also get a lot of hesitance from young people when I start to bring up therapy, and often get the response, well, I tried it before and it didn't work. And so I also wanted to share with you some of the tips and things that I talk about with young people who are considering whether they want to do this. So the first is success in therapy is finding the person you feel comfortable with and click with. It's sort of like finding a best friend in a way. You're not going to click with everyone. You're not going to feel comfortable opening up to everyone. And so sometimes it does take a couple of tries before you find the right person. So that leads to, if you do try it and it's not working out, it's okay to say, I'm done here and I'm going to look somewhere else. It may take a few, that's okay. Young people often are, like, they feel awkward about ending that relationship, or they feel bad, or they don't want to hurt people's feelings. So it's also really important to reassure them, like, we get it. It's okay. We don't take it personally. And we just want you to find the person who can help you be successful. And so sometimes reminding people of all of those things can be helpful as they're considering whether that's right for them. I also briefly want to touch on eating disorders because rates have really been rising post-COVID. And as I mentioned, this is much more common in people with chronic illness than in the general population of young people. What are the signs that you need to look out for? So appetite can fluctuate, especially as you're trying different medications or just sort of adjusting to everything that comes along with new diagnoses or flares. Some of the things that may not be as normal. One is cutting out foods or food groups that they previously enjoyed. So if you have a child who has always liked a wide variety of foods, they eat vegetables and lots of fruits, and they have grains, they like bread, they like pizza, and all of a sudden they eat none of those things, and they have a very narrowed group of foods they will eat, that's a sign that maybe something is going on. Skipping meals and snacks is very common. Unfortunately, it also can be pretty normal because half of my teens that I see don't eat breakfast. That is okay. I don't necessarily force the breakfast issue as long as they're getting their nutrition elsewhere. It becomes abnormal if you're not eating breakfast and you have a small lunch and then maybe you have dinner, but you never supplement it with snacks, or you never have a third meal to replace breakfast. This is a time your children need a ton of nutrition because they're really growing and developing. Anxiety around eating in front of others. So some parents start to notice that their young person won't order if they go out to eat because they don't want other people to watch them, or if they order, they just push it around their plate rather than actually eating it. But sometimes I also have parents say, they'll only eat in their room, or they only eat at night when nobody else is awake. Those can also be warning signs. Exercise is great. Exercising too much is not. And so people who over-exercise, that can look like a lot of things. You can be a long-distance track runner, and it's still important. I guess cross-country maybe does more long distance. But you still recognize the importance of having a day off. If you're a young person refuses to take days off from exercise, that's not healthy for them. If they feel like they need to exercise in response to eating, that's also not healthy. Another warning sign can be leaving right after meals to go to the bathroom. Of course, some people have other things going on, irritable bowel syndrome, but if they don't, and this is a pattern, it's something also to watch out for. I think the other important thing to note that I find a lot of families don't realize is you can still be at what's considered a normal weight and have an eating disorder. And so it's not necessarily about numbers so much as rapid changes in weight. Even if you're still normal weight, you can be in a dangerous position where you can have long-term ramifications of the eating practices that you have. So what are some tips to help young people develop positive body image and prevent eating disorders? So it's important to start having conversations with your teen about body image. Encourage them to question beauty standards and ideal body types, because this is really pushed in media and social media. Avoid commenting negatively on bodies. That includes yours and theirs, because when they see you not having a good relationship with your body, it's harder for them to develop that good relationship. Encourage your teen to enjoy all types of foods. So avoid labeling foods as good foods, bad foods, healthy, unhealthy. The mantra in adolescent medicine is all food is good. It all depends on how you appreciate it and consume it. Eating meals together as a family is really protective too. It's important for them to have good role models of what good nutrition looks like in nourishing your body and listening to hunger cues. If your child is wanting or someone suggests they might need to lose weight medically, I would really encourage you to talk to a doctor about it and make sure that the way that they go about it is safe. Because I've seen a lot of people start that way and then it just sort of snowballs and becomes a bigger problem. I do have some resources on these topics as well. The top one talks about different mental health conditions and resources for those. The second one, Psychology Today, is a way that you can find a therapist local to you. The hardest thing is finding someone who takes your insurance and is accepting patients. And I talked to my social worker, and this is how they find all that information and email it out to my patients. So you can just skip the middleman, type in your information, and it'll help connect you. For young people who have questions about periods, the period book can be really helpful for them. Amaze.org is a website that talks about puberty. There's the regular Amaze for older teens and Amaze Junior for like that early adolescent stage. And it's these little videos that break it down into, age and developmentally appropriate ways of explaining it. And so you could either share with your child, you can watch with them, or it can give you ideas of how do you talk about it with them, because it can be hard sometimes to start that conversation. And then Young Women's Health has a bunch of resources on teen health, talking about nutrition, talking about mood, and everything in between. And there are guides for you as parents as well as for your young people. I'm also going to talk a little bit, just touch on reproductive health, because for those older adolescents, middle adolescents, they do start to think about, what do I want for my future? Do I want kids? How does my disease affect this, and how do my medicines affect this? I recognize this is an uncomfortable topic to talk about, and none of us really want to think about our kids engaging in intimacy really at any age, but it's all the more important because of the rheumatic disease that your child has that you start to think about these things and have some of these conversations to help them plan ahead. One of the most important reasons for this is because many of our young people are on medicines called teratogens. These medicines can cause birth defects, developmental differences, and high rates of miscarriage if you become pregnant while you're taking one. Common one for teens in general is Accutane, which people use to help treat acne, but in our patients, methotrexate is used all the time, especially for JIA and scleroderma, mycophenolate for people with lupus, vasculitis, or scleroderma, and even cyclophosphamide for people with pretty severe lupus or vasculitis. And all of these can have those impacts. So what does that mean if my child is taking this, and how might that affect their future? So I do want to say this is only while they are currently taking the medicine, and is not they will forever be impacted. And if they want to have kids later, they certainly can. It just takes a little bit more planning. And so what's important for you to share with them now is you need to wait for a time your disease is inactive. The reason for this is because it's not a good idea to switch off of a medicine while your disease is active. We don't know what it's going to do. The other piece is that if you become pregnant as someone with JA, and it's not very well controlled at the start, it tends to flare after you deliver. And so we want to wait for a time that it's the safest for that to happen. They need to talk to their doctor about their plans. This is not, I've decided I want to have a kid now. This is, I think sometime in the next 5 years, that might be my plan. What do I need to consider? Because your doctor wants a minimum of a year before you plan to start having kids so that they can change your medicine and make sure that the disease isn't going to flare on that medicine. And if you know earlier, you have more time to try other management strategies that are safe in pregnancy. The most important thing to know, even if you become pregnant while on one of these medicines, never stop the medicine until you've talked to your doctor. Just because you're on it doesn't mean that you will have these. These are just risks, and it doesn't happen to everybody. And we don't want your disease to flare because you suddenly stop taking a medicine. So call your doctor and they'll help you figure out what makes the most sense. I also will briefly touch on birth control because it's an important consideration for people on a teratogen and also for those who are not but have other medical conditions that can benefit from taking it. So other than pregnancy prevention, birth control can be helpful for regulating periods because JA can cause missed periods, irregular periods, or sometimes even prolonged periods. It can help control period cramps. It's actually very good at that. It can help with acne. Some kinds treat it quite well, especially if you notice that you flare up a lot around your period. It also is used to treat diseases such as PCOS or endometriosis. Because it can do so many things, it's also really important that you know some of the considerations that come along with using birth control in case your young person might ever need it. So I want to make sure you know some of the risks that can come with it. Some, not all, have an increased risk of blood clots. These are the ones that have estrogen in them. And this risk is very low for our young people in this age group. But if you have other conditions that predispose you, the risk might be too high and something else would be safer. Other kinds can decrease your bone mineral density while you're taking it. It goes back to age-appropriate levels after you come off of it, but if you're doing other things like taking long-term steroids, the two together can increase your risk of fractures. So what is it that you need to tell the doctor who might prescribe birth control? You need to let them know if your child has ever had a blood clot. That's really important. You need to tell them if your child has either severe lupus, active lupus, or vasculitis. You need to tell them if your child has positive antiphospholipid antibodies. No one really knows what these are when I talk to families. And so this is some information that you should ask your rheumatologist ahead of time because these are antibodies that increase your risk for developing blood clots. So you should not take some types of birth control while on it. If you're taking steroids, that's another important thing for your doctor to know because that can impact how safe certain kinds are for you. And so all of these will really be helpful in getting an answer quickly in the safest way of helping your young person. Other things to know, people worry about medication interactions. Really, the only medicine that I use that interacts with birth control is mycophenolate. But birth control doesn't make mycophenolate less effective, it's actually the other way around. So you might be more likely to get pregnant even using hormonal contraception. Now you can use 2 different kinds, non-hormonal, etc., or you might want to go towards something that's more effective. But there are no known interactions between birth control that make your rheumatology medicine less effective. And it's also important to know that none of these have been shown to cause flares in JA either. That concludes my talk, but I do want to give a shout out to the Arthritis Foundation and highlight all of these ways that you can help connect with them.